Today, the Minnesota Department of Health received a $3.8 million lead paint hazard control award from the Department of Housing and Urban Development. That award is given to local governments who work towards affordable ways to reduce the toxic paints and provide public outreach. Let's take you there now and hear what they had to say.
On behalf of Secretary Marcia Fudge and the Biden-Harris administration, I want to congratulate the Minnesota Department of Health on their $3.8 million grant and their successful efforts for funding to prevent lead poisoning and create and sustain healthy homes in our communities. 2 weeks ago, October 22nd through the 28th, communities around the country observed National Lead Poisoning Prevention Week. We were very close to making that week worth for our gathering today, but we're just a little bit late. But I am really happy to be here today, and thank you all for your time. The theme of our National Lead Poisoning Prevention Week for 2023 is Together We Can Prevent Lead Exposure. And the key messages are get the facts, get your child tested, and get your home tested. This year, HUD awarded nearly $140 million to 36 state and local governments across the country to protect children and family from lead-based paint hazards and other home hazards. This funding will make low-income families safer and healthier in southeastern Minnesota. The goal of the program overall is to reduce the risk for lead poisoning in children by increasing the amount of lead-safe housing, especially for households with children under the age of 6. Eligible applicants will receive a free in-home assessment to identify lead paint and other safety hazards, and we are really grateful to be partnering with the Minnesota Department of Health.
When the Minnesota Department of Health looked at the places that we wanted to service with this grant, we knew logistically that we needed to start with just a portion of the state. And so we concentrated on southeast Minnesota because there are a large number of communities in southeast Minnesota with more than the average level of elevated blood lead levels among children. There's also a lot of older housing as well as poverty in southeastern Minnesota. And so we really targeted that area because of all of those factors combined having the need. Another thing I wanted to mention, we do have our forms up online that families, if they are interested, can express interest by going to our website, filling out an online form with their name and some basic information about their housing so that we can help screen to see if they might be eligible. And we have that available in both English and Spanish.
The people who it will impact the most are those children who are under age 6. They're the most vulnerable for lead. It just winds up, it's a cruel irony that the very years when they are crawling and putting their hands in their mouth, that's a normal behavior, that's how they pick up the dust. And when they put their hand in their mouth, that's how they get the exposure to the lead. And at 2 years old, their brain is still very much developing, and so the lead gets in and it kind of it impacts the way your brain develops, and that leads to a whole list of health effects. And so by getting the lead out, again, for that family and that child, they then are able to have a much more successful life and earning income, and all the things you want to list from that all kind of come from getting them a good healthy start.